Good afternoon. I'm Caitlin Mann, a senior at Hathaway Brown School and a member of the City Club Youth Forum Council, and I am pleased to welcome you to this afternoon's forum. Today, Dr. Solomon will be speaking about how the public health world is changing in the 21st century. This is an especially important discussion because the more information people have, the better able they will be to treat and stop the spread of potentially dangerous diseases. With our ability to travel more easily around the world, transmission of disease can occur without any forewarning. It is vital to the health and safety of all people to be well informed about issues of public health and their impact upon society. Dr. Steven L. Solomon is currently serving as the Director of the Coordinating Center for Health Information and Service and the Assistant Surgeon General at the Center for Disease Control and Prevention in Atlanta, Georgia. He received his MD from Tufts University and is board certified in internal medicine, preventative medicine, and infectious diseases. He was in the private practice of internal medicine and infectious diseases before joining the Epidemic Intelligence Service at the CDC in 1981. He has held several positions at CDC in developing, conducting, and directing collaborative research and demonstration programs with academic institutions, hospitals and health systems, and state and local health departments. Dr. Solomon has recently focused on health systems research and using information technology to evaluate and improve health services. He has represented CDC on expert panels for a number of national organizations. Today, Dr. Solomon will be speaking on how the 21st century public health world is changing. Please join me in welcoming to the City Club podium Rear Admiral Steven L. Solomon.
Thank you very much. I appreciate that introduction. Well, thank you for inviting me here today. I want to thank the Youth Forum Council. I appreciate the opportunity to come and tell you a little bit about what we do at CDC and what we do in the Public Health Service. I'm not in the Navy. Some people think I am. And we can talk, if you want to know a little bit more about the U.S. Public Health Service, we can talk about that during the question and answer period. And I'll just mention a couple of things during the talk. But I really want to get into the substance of what we're going to talk about today. And I want to make 3 points to you today. I want to talk a little bit about what public health is and why it's important. And I do that because even after I graduated from medical school, I didn't have a real good sense of what public health is. It wasn't in the curriculum. Now, that's changing. That's changing in the last 10 years or so. There's more emphasis on public health for some reasons that we'll talk about. But I do want to give you just a little bit of background in public health. Then I want to talk about how the 21st century is going to be so different even than the 20th century. And I want to talk about some of the things that we need to be doing over the next 10 years. And then I want to close by talking a little bit about what your role is going to be, because you guys are the 21st century. And so if I'm talking 10 to 15 years in the future, you're really going to be in the thick of it, regardless of what you do. I'll explain to you a little bit later why that's true. Now, they always say you should start with a story. So to talk about the 21st century, I'm going to talk about the 14th century. And I'm going to tell you about how in 1347, a ship pulled into the port of Genoa, Italy, and some sailors got off. And over the ensuing 4 years, 1/3 of the population of Europe died of the bubonic plague in 4 years. It's hard to imagine what that means. 1/3 of the population, about 100 million people just in Europe, died over a period of 4 years in the 14th century. And that ship, with those sailors on it, and it had the rats and the fleas that bear the bacteria that causes bubonic plague, came from Asia, where the disease had been spreading in an epidemic fashion for almost 20 years before that. So you had decades of this disease spreading around the world, killing tens of millions of people. So why is what happened in the 14th century important for the 21st? Well, let me hold you in suspense on that and just talk a little bit then about what public health is and why public health, the way we think of it today, is a relatively new phenomenon. A group of scholars a few years ago defined public health as what we as a society do collectively to assure the conditions in which people can be healthy. What we as a society do collectively. So now sometimes people think about public health as just what the government does. But the definition that these scholars came up with involves the fact that everybody is part of the public health system. Now, the government does have a very big role. Every city and county in the United States has a public health department. Every state and territory in the United States has a public health department. But surveys have shown that most people have very little, if any, direct contact with the health department, and most people don't know what the health department does, with the possible exception of inspecting restaurants to see if the kitchen is clean. There was, in New York, it happens in lots of different places, but in New York just a couple of years ago, there was a Taco Bell downtown, and the way it was set up, it had these huge plate glass windows in the front. And sometimes happen, now everybody has cameras, of course, they have cell phones, and somebody was walking by the Taco Bell, and what they saw looking in the window was rats. The place was closed, hadn't opened yet. Rats all over the floor, running, picking up. They weren't, when they closed up the night before, they hadn't done a real good job of cleaning up the floor, and the rats were having a field day. So, of course, then the health department was called, and they closed the place down and cleaned it up. But that's what people think about when they think about the health department. They think about rats in the Taco Bell. And that's important. But let me tell you a few other things that public health does. It ensures safe food, water, and safe drugs. You may remember that about 3 or 4 months ago, there was a nationwide epidemic of food poisoning caused by jalapeno peppers imported from Mexico. Finding the source of that outbreak, finding the source of that contamination, and taking those peppers off the market so that more people don't get sick, that's public health. Sometimes you hear about drug recalls. In 2004, there was a very popular medication called Vioxx that your parents or grandparents may have taken. It was used to treat arthritis and a whole bunch of other things. Unexpectedly, it was found after the drug was on the market for several years that people who took that drug had a much higher risk of getting heart disease than had been expected. So that drug was pulled off the market. And many, many other drugs don't even make it to the marketplace because when they're tested, they're not found to be safe. And the responsibility of public health is to keep unsafe drugs off the market. And if they're found to be unsafe after they're on the market, they get pulled off. In October 2001, just 3 weeks after the attacks on the World Trade Center on September 11th, someone started mailing weapons-grade anthrax in envelopes to U.S. senators and to TV stations in New York City. In the end, 17 people were infected with anthrax and 5 of them died. Public health officials in New York and around the country began to investigate that in conjunction with the FBI. It was public health that needed to find the source of that anthrax and take steps to make sure that more people didn't get infected. You may have heard about superbugs, antimicrobial resistant bacteria, bacteria that are resistant to all the antibiotics that are now on the market. Public health has been successful in trying to keep some of those bacteria from spreading further. But that's a battle that goes on because bacteria keep evolving and getting resistant to new drugs. As soon as we get new drugs, the bacteria begin to evolve and become resistant to them. That battle goes on.